November is Hospice Month, a time to raise awareness for this vital healthcare service. And in recognition, we're learning more today about hospice care and the many benefits it offers. I'm Laura Wheatholder. I'm a registered nurse and community outreach coordinator for Blessing Health System. I'm joined today by social worker Trista Neisen, who is a member of our hospice team. Trista, can you take a moment to introduce yourself?
Sure, absolutely. Thank you for inviting me to do this, Laura. My name's Trista Neisen, and I'm a social worker with Blessing Hospice. I've been with Blessing for over 25 years, and the majority of my time at Blessing has been with hospice and providing services to our hospice patients. I primarily cover our Adams County and Pike County area, but I've also had the opportunity to work in our Hancock County offices as well as Brown County.
Well, thank you so much for joining us today and, for being a member of our hospice team. It's such an important service. So, first of all, what is hospice and how can it help patients and their families?
So, hospice is a service that is provided to individuals whose physician has said that they have a life limiting illness with a prognosis of 6 months or less. Some of the services that we provide, we focus more on comfort care and symptom management. Symptom management can be a variety of things, whether it's pain management, anxiety, depression, nausea, vomiting, shortness of breath. Those are some of the things, physically as well as emotional support for our patients and our families. We also provide equipment in the home that patients may need, as well as medications and supplies patients and families need to care for their loved ones at home.
And so now I think one concern that some people might have is that hospice means that their loved one is maybe giving up, but that is not necessarily the case, correct?
That is correct. We focus more on quality of life versus quantity of life. That's where good symptom management comes in, like I had talked about in that first question that you and I had talked about. When somebody's symptoms are controlled, they're better able to do the things that they used to be able to enjoy, whether it's being with friends and family, going to special events and outings. We certainly talk to our patients and families when we get involved with them. Maybe what are some of the goals that you want to be able to achieve while you're still able to do it, and helping them if we can achieve those goals, and what is it that we need to do so that they're able to do those things. We offer a team approach as well when working with our families and our patients, because not only are we there to care for our patients, we're there to care for their families as well. And so what that team approach is we have a medical director as well as a nurse practitioner. So we have 24-hour access to them if we're not able to utilize their primary care physician or the physician of their choice for hospice services. On top of the physician and the nurse practitioner, our team also consists of a nurse case manager, social workers, a chaplain, home health aides, and volunteers. We want to make sure that we have all of those services available so that we can meet our patients' needs and care for them.
So, beyond focusing on quality of life for patients, hospice can also provide support and services for family members. Can you talk a little bit about that?
Sure. So one of the things that we do too going into the patient's home is really just spending time sitting down and listening to our patients and families and finding out really what it is that they want. We're coming into their homes, we're helping take care of them so that they're really still in charge and directing their care, even at that point, even when we're coming in and case managing. We're a good resource for our patients and families to talk to when maybe they don't know who else to talk to, or they don't want to burden their family members with how they're feeling and what's going on with the situation. So it's just really being that extra set of eyes and that extra set of ears to help them through this process. Some of the other things that we can do is if they need to be linked to community resources, whether it's because they need assistance with finances, applying for public aid, nursing home placement. Sometimes it's just funeral home assistance and getting them linked up with the funeral home or making them aware of some of those resources that are out there, because oftentimes this is the first time some of these families have been going through this. And so it's just helping guide them through that process and to take some of that burden away from them and things that they wouldn't necessarily think about. Advanced directives too is a big thing that we can help with. Some of our patients and patients don't have a healthcare power of attorney when they come to us, or even that post form or that DNR. So it's just really providing them with that information, helping explain to them what options they have so they can make informed decisions too about their care.
So it sounds like really hospice is very individualized to the patient's needs and as well as to the family's needs. So it's just a a level of care that's very personalized and individual based on that individual circumstances.
Yes, that's correct.
Now, I know transitioning to hospice care is an important decision. What else do you feel people should know about hospice, or would you want someone to know if they were considering that, or even think that they might want to know more?
One of the things that I would suggest they do is, reach out to their physician, ask their physician, about hospice, what they know about hospice, if they think that that would be right for them. But if they just need further information, they can always call our office at any time, talk to any of our staff members. If nobody's available, somebody will call them back and just explain our services a little bit more in depth to them and what we might be able to do to help.
So we've touched on a lot today, but is there anything else that you feel it's important for people to know or would want people to know about hospice care?
A lot of people wonder how hospice is funded. So, when we're looking at reimbursement for hospice services and the hospice services that we provide, we bill Medicare, Medicaid, and private insurance. We don't turn anybody away because of their inability to pay. So, we provide services to everybody. And a lot of people, when we talked a little bit about supplies and things like that, those things are all covered under their hospice Medicare benefit. So, if they have any other further concerns or questions, certainly reach out to our office and call us, and we'll be certainly happy to explain those services a little bit more to them.
Well, it's a very important service and a resource that I think is important for a lot of patients and a lot of families. And I really appreciate you taking time today to explain this to us and to talk a little bit more about hospice. Thank you so much for your time. And you can always find out more about hospice, about Blessings Hospice Program on our website, blessinghealth.org. Trista, thank you so much for joining me today.
Thank you. Have a
Thank
good
you.
day.
You too.